Welcome to another episode of our In Conversation live series. At Sitaram Bhartia, we lay an emphasis on ethical medical care, and for the last 30 years, we have been providing the care that you can trust. Today, we're in conversation with Dr. Payal Chaudhary, obstetrician gynecologist with over 16 years of experience. Dr. Payal has completed her MBBS and MD from Lady Hardinge Medical College, New Delhi, and she has a keen interest in urogynecology. She is also known for her expertise in natural birthing and, of course, her warm and compassionate approach, which puts every woman at ease. Welcome, Dr. Payal.
Thanks, Sakshi. Good afternoon to all the audience out there. So,
So today, yes, ma'am. So today we'll be talking about how to deal with pelvic floor dysfunction. Dr. Payal, to begin with, thank you again for being here. To begin with, if you could maybe explain to us exactly what is meant by pelvic floor, but in simple terms.
sure. Pelvic floor is actually a group of muscles which are housed inside the pelvic bone in our body, and through which the structures like uterus, bladder, and rectum behind, all of them pass through. So, just to, if you can see the image on the screen, in the front is the urinary bladder, then the uterus, and then the rectum, and they are passing through a hammock like muscular area, which is like a flat slide like area through which these organs are passing through. Just to give an example, if you can see on the in my hand a pelvic bone, this is through which all the organs pass through, and on both the sides of this pelvic bone actually the legs of a human body are. So the uterus goes through the inlet of the pelvis like this, and it stays stable there and does not fall down through the vagina because of that hammock like support. So just to give an example, this paper, let's consider it as a group of muscles, and through this passes the vagina, and is housed inside this pelvic cavity. When this is there, it does not let the uterus fall down. But when this muscle group is weak or is damaged by childbirth and various other conditions, that is when we see that uterus tend to come down. And I guess we'll be talking as we move forward about what is called as prolapse, that is uterus coming out through the vaginal opening and down.
All right, okay. That was well demonstrated, ma'am. I think that gives us a visual representation of how it actually looks. So that was very well explained. You did mention that when the pelvic floor muscles weaken, then there could be certain problems like prolapse. Could you maybe elaborate about what exactly could lead to the weakening or improper functioning of these pelvic floor muscles?
So these pelvic floor muscles actually are the big support against gravity. Otherwise, we humans are upright, so all the tissues, all the body organs have a tendency to come down if something does not hold it up. So pelvic bone, along with that hammock of muscles, is what holds everything inside. But these muscles sometimes become weak. That could be due to aging, because as women age, after menopause, important hormones like estrogen reduce in the body, and that weakens the group of muscles that is holding it there. Second is, people don't exercise them regularly. In fact, most of the people do not recognize it as a group of muscles sitting there, so no exercises are done for that area, so that is why they weaken over time. Third major reason is childbirth. There is bound to be some laxity coming in, some injury to surrounding areas when that baby comes out through the womb, outside the body. And that weakening actually can be, one can get back that strength if one exercises post delivery. So childbirth in itself causes trauma to the pelvic floor, which only gets repaired if, postnatal exercises and strength is gained back, which most of the people don't know and don't do. So that's another reason for weakening of the pelvic floor. And sometimes people have chronic cough or constipation. In them also, the constant pressure of every time you cough, every time you push, you strain to pass motion, is what would cause weakening of the pelvic floor over time. So you see it more in older age group, but that does not mean, it does not happen in the younger age group. Actually, you can say that the condition starts at young age and it manifests later in life sometime. But for some women, yes, it does manifest early also.
All right, okay. So, as you mentioned, there are quite a few different factors that could lead to weakening of the pelvic floor muscles. It's also interesting that something as, something like a chronic cough or straining for that matter could, over a prolonged period of time, lead to that. So, in general, like you have also previously mentioned, ma'am, prolapse is something that we often see, that you often see in patients. Could you explain exactly how prolapse is related to pelvic floor dysfunction?
Explained how pelvic floor is located inside the bony pelvis and through which the vagina actually is passing through. We saw that image earlier also, that you know how it houses the uterus and the tubes and everything inside the pelvic cavity. But when these muscles weaken, when this area opens up more, the uterus, as you can see in the images, uterus tends to come down rather than staying up above in the abdomen. So in stage 1 it is slightly down but still housed within the vagina, so not visible, but women may feel some pressure. Then the second stage is when it comes further down, one can feel it at the opening of the vagina, that there is some mass that is sitting there but does not really come out of the body. That's kind of stage 2, that's the second stage. By stage 3, half of it almost is outside the body through the vagina and is uncomfortable. When women go to pass urine, they may feel it, or they may feel it that it is progressing over the day, and by the end of the day they have that sensation of something coming out of vagina. Stage 4 is actually the, you know, the highest degree of prolapse. This is when the whole of the uterus comes out through the vagina and is sitting outside, and it's a really uncomfortable condition for women. This is one condition which actually deteriorates the quality of life to a large extent, and it also causes certain, you know, urinary symptoms, because if you remember, the bladder is right in front of the uterus and the bowel is behind, so some amount of bladder may come down, which is called as cystocele, and you know, the rectum may fall downwards, which is called as rectocele, and that also causes difficulty sometimes in passing motion, or difficulty in passing urine, or a slow stream of urine, and also sometimes incontinence, that is urine leakage happening along with the uterus coming down.
All right, okay, ma'am. And so, you've explained all of these different stages, and it's again, I mean, like for us to sort of understand each and every of the all of these stages is interesting because there are, like you said, it's a progression in a way. So, at what point in time then should women, according to you, seek help? In the sense that if you could maybe highlight, the few different symptoms that women may feel, or if there is ever a situation where they may not even feel any symptoms and it still happens. That kind of a situation, if you could talk about that, and also about what kind of treatments can be offered to them.
Definitely, Sachi. Yeah. So, as far as prolapse is concerned, you know, generally what what the symptom you would have is sense of something coming out of vagina, or sense of lack of control in the lower vaginal region. Some women actually complain of that, they don't enjoy having intercourse anymore. There may be urinary symptoms there, like as I said, intermittency of urine, रुक रुक के यूरिन आना, the flow is not good, the flow feels to be blocked, or sometimes incontinence, that is some amount of urine leakage happens on coughing or straining, could also be the symptom. Even bowel symptoms, because at times it is not the uterus majorly which is coming down, it could be the rectum which is protruding through the back wall of the vagina, which has weakened. There are these fascia also around the pelvic floor, around the vagina, which get torn or which get weakened due to childbirth and also later in life, due to, as I told, lack of estrogen, and that also leads to rectocele coming out and majorly just having bowel symptoms. So if you have difficulty passing motion, you have a sense of feeling something down there or something coming out of the vagina, if you have urinary symptoms like intermittency happening or urine leakage happening, if you have a feel of something coming out, like you can't make out what it is, but there is something that comes out, especially by the end of the day, especially after prolonged standing, then that requires assessment. And I think that's the time to seek. In fact, you can seek help beforehand. This is when you are symptomatic, you're seeking help. If you will wishing for prevention, then one needs to understand what group of muscles to strengthen, how to strengthen them, and learn those exercises, first getting them assessed. So whenever you have a visit with a gynecologist, or if you feel you already have any of those symptoms there, you can come and get it assessed and start doing those exercises. Just knowing those exercises sometimes does not lead to women doing them properly. So the first step to treating this condition is to start exercising to strengthen the pelvic floor. In fact, this is the most important thing that needs to be done, because muscle, if are not strong, any amount of surgery, any amount of intervention is not going to work till we strengthen the muscular area there. And for that, learning pelvic floor exercises is important. Other things which help are things like biofeedback and electrical stimulation of the muscles. Then as far as intervention is concerned, like full treatment kind of a thing, there are surgeries that can be done. Surgeries, it does not mean that every woman who has a uterus protruding out requires removal of the uterus. There are conservative surgeries available too, which just strengthen the area around the pelvic floor and strengthen the tissues around, and would not require you to get your uterus removed. So but that assessment is done by the gynecologist, and then the decision for the surgery is taken. Surgeries are generally done vaginally or laparoscopically, in which sometimes a mesh is used, like it is done for surgeries like hernia, and the uterus is pulled inside the body so that it stays up. And sometimes if you have symptoms of urinary incontinence, even placing a mesh like structure underneath the urinary passage, that is urethra, which are called as slings, also works wonderfully well in this group of women. There is conservative treatment in the form of pessaries as well, but that's an interim treatment. You can't think of having it, some women do keep them for 10 years, 15 years or so as well. But yes, for interim or women who are not interested in surgery at all, sometimes pessaries work wonderfully well for them.
All right, okay. Those are a few good points that you mentioned there, ma'am. And actually, there was quite a lot of useful information that you mentioned overall in general. I do have a few questions related to that. So, for example, you mentioned actually one good point that you mentioned was that not every woman who has a prolapsed uterus needs to undergo surgery. That is, I think, something that not everyone knows and might realize. So, and also sometimes women are a little apprehensive about surgery, and so it's a little reassuring that they could maybe, if they've been advised, maybe they can get a second opinion to actually find out whether they actually need it or not. Um, from the point of view of other, treatments that you mentioned in terms of pessaries, also, is there you? I understand that you said that it's an interim form of treatment. It's probably not like a permanent solution as such. But is there any specific length of time, like you said, 10, 15 years? Is there any maximum duration for which you could have it?
Pessaries are silica made, so they have a good strength, and they do not, the material does not deteriorate much over time. So actually, if somebody is comfortable using them, there is no end point to okay, one day this is now the pessary is aged and changed. Maybe when it changes color over time, even with the slight change of color, one can continue to use it. They generally come white in color, silica based, and they're very, very good strength. And they there's no specific age to them, that okay, 5 years remove it, 10 years remove it. No, but keep it clean, keep it, remove it, wash it, reinsert it every 15 days or so, and it can last for years and years.
All right, okay. And again, about the symptoms that you mentioned, these are usually symptoms in terms of the pressure that women feel. Uh, can there be a situation where people don't feel any symptoms and it's still occurring?
Very common, that some amount of uterine descent, the uterus would come down into the vagina, and the women may have no symptoms at all. In fact, initially that is what it is, that there is a small amount of descent and one does not have that sensation of dragging sensation or pulling sensation down there. And so that is why sometimes we get women coming in really late with a prolapse when it's already completely protruding out in stage 3 or 4. But time to take action is when it's actually starting. So getting assessed when things are at its initial is actually the best time to work on them.
Okay, I think that is something that we all should note. Ma'am, also you had mentioned incontinence in one of the previous answers. So that is something in terms of leaking of urine that I think that a lot of people do face, irrespective of the age. Actually, sometimes it's felt in younger women, sometimes it's in older women. Can you elaborate about how that is also related to pelvic floor dysfunction?
Definitely. First, I want to make it clear that incontinence or leaking of urine is not always related to prolapse. They can be two different conditions. One may not have a prolapse at all and still have leaking. There may be others who will have leaking along with prolapse, and there are different kinds of leaking. For a woman, of course, she leaks and there is no control, so for her that's one major symptom that is there. But there are various causes of leaking that could be there. One is because of lack of strength of the pelvic floor, and how the muscles around the urethra don't contract when one has coughing or sneezing. As I said, people with chronic constipation or cough may have what is called as stress urinary incontinence, that is leaking on coughing, straining, picking up a heavy object in hands, or it may be associated with prolapse as well. So that's stress urinary incontinence, which requires completely different treatment from what is called as urgency incontinence. That's another form of incontinence that's there, that sometimes is also seen in people with comorbid conditions like diabetes, etc. And in these cases, actually, what you will see is that normally the urge to pass urine comes and one can easily hold it for few minutes, sometimes an hour also, once we are busy like the way we are chatting right now. And if one of us has an urge to go and pass urine, we are not going to get up and go. We know we can hold on to it. But there are women who once they get the urge to pass urine, they have to run to the bathroom and do it. That's urgency incontinence, and that's an issue inside the wall of the bladder, the muscles around the bladder, and not really with the pelvic floor or with anyway associated with prolapse. So assessment of what kind of incontinence becomes important in those cases, but majorly with pelvic floor it is stress urinary incontinence that's associated. I hope that answers your question.
Yes, it does, ma'am. Also, so like you said, there are these two, three different types of incontinence that may occur. So what I'm also wondering now is whether I mean I am assuming that the treatment obviously will differ depending on what kind of incontinence it is. Um, but again, if you could maybe talk a little bit about that in terms of how the treatment would differ.
Yeah. So I told you there are two major kinds of incontinence. Sometimes they come together also. Then it's called as mixed incontinence. So when it is stress urinary incontinence, yes, pelvic floor strengthening helps a lot. So doing what is called as Kegels exercises, one needs to learn them properly. It has been seen in various studies that 80% of women who do Kegels exercises don't do it right. They are actually not contracting the right group of muscles. So the group of muscle that you're supposed to contract is around the vagina. That is the muscles which contracts when you have to hold urine. Suppose the stream of urine has to be held in the middle. The muscle that you will contract is the pelvic floor muscle. You don't have to contract your abdominal muscles or your thigh or inner thigh muscles, and just the inside of the vagina, those muscles are to be contracted. So learning to do the right way to exercise becomes really really important in this. And stress urinary incontinence improves to a good extent by just doing pelvic floor strengthening, but it takes time. 3 to 6 months of exercising, doing it properly, number of times in a day, and sticking to it brings a lot of change. Other thing that works for stress urinary incontinence is surgery. Actually, I did mention about that. That sling surgeries work really well. That is putting a sling in underneath the urethra, that is the tube that transfers urine to the outside. And if that tube is, this sling works like a hammock like thing. So the moment a woman coughs or sneezes, the sling comes up and closes the urethra, and that prevents then the incontinence or the urine leakage. So that's another surgery that can be done. Then there are laparoscopic or abdominal open surgeries also, things like Birch Colpo suspension. These are procedures which are done for that. And as far as urgency incontinence, that is, desire to pee or urgency to pee as soon as the desire is felt, for that, actually, again, pelvic floor physiotherapy does help. Along with that, some medications sometimes work. And it is not amenable to any surgery per se, but yes, these things work sometime in very severe cases or refractory cases. Even injections into the bladder of certain muscle paralyzing agents or like botulinum also is done. So these are various therapies that are done. And if you have uncontrolled diabetes, sometimes just controlling the sugars and doing these conservative lifestyle intervention makes a change.
All right, okay, ma'am. And again, that was, you put it across very well. You did mention exercises, and you did mention about how 80% of women are found not to be doing it correctly. So that I think is again important for us all to take note of, in the sense that if we are, starting to do exercises, we should probably do it the right way. Is there any specific approach that you would suggest, in the sense that, firstly, how does one know about which exercises they should do apart from Kegel exercises? I mean, if you can just suggest how it, is it that they are recommended exercises? Would you do it? Would you do it in conjunction with a physiotherapist? And also the approach. I mean, sorry, should they go to a physiotherapist straight away, or what is it that they should do?
So this physiotherapy is completely different from the regular physiotherapist that people go to. A pelvic floor physiotherapist actually can teach one who has been trained in pelvic floor physiotherapy that how to identify those muscles and how to strengthen them. Or you can go to your gynecologist, and they can help you identify that muscle and then teach you how many times a day you have to do it, how long you have to do it. And that has to be like, as I was saying, once you recognized your pelvic floor, you're supposed to contract for 10 seconds, relax for 10 seconds. Initially you may not have strength to do that, and that has to be done, say, 10 times in the morning, 10 times in the afternoon, 10 times at night. So but understanding first that which group of muscles it is, visiting your gynecologist or visiting a pelvic floor physiotherapist can help one in understanding that. And the rest then one has to continue doing at home. And sometimes, one may recognize it in one go, but if does not follow up after a few weeks, or after a week, 10 days, may start using the wrong muscles again. So it requires reinforcement also. That is why, doing things like biofeedback, these are machines which help in letting you know which group of muscles and how well you're contracting them, sometimes helps in improving the muscular strength of the pelvic floor over time. So yes, it does require you to visit a gynecologist or a pelvic floor physiotherapist. In fact, post delivery, when women go to for a routine checkup, that is also a good time to assess the pelvic floor, to understand how to strengthen it, and then start doing it right away thereafter.
Okay. And ma'am, so we are getting a few questions. One question is from Ritu. She says that her mother has been going to the washroom repeatedly, especially at night. Is there any specific suggestion that you have for her? I mean, obviously, it requires a detailed evaluation and a consultation, but anything that you might want to suggest?
this could be urgency that she's feeling, that is the desire to pee as soon as the bladder has some urine in it. Sometimes it is also the lack of sleep that is happening as the age advances. I hope she's not a diabetic, because diabetics, if they are uncontrolled, would also feel similar symptoms. And at times it is too much intake of caffeinated beverages, that you're taking a tea later in the evening, you're taking too much liquid, which is really propagated in today's time for various things. But there is, there is everything in excess is bad, and so is a lot of fluid intake in excess is bad. So maybe if she's taking a lot of liquids in the evening or at night and then going back and forth, could be the cause. So home remedial stuff can be that from 5 p.m. in the evening she should not take any coffee, tea, restrict her fluid intake. And if she's not been checked for sugars, maybe good time to get a check done on that. And sometimes, as I said, the bladder wall becomes irritable or causes what is called as urgency. In that case, it requires an evaluation. She would need to come in, get a check done, and if medication is what needs to be prescribed, then that can be done as well.
Okay, I think those are quite a few valid causes that you outlined. That definitely makes a lot of sense, and it's different aspects that one should definitely look into. Ma'am, there is another question that we had previously gotten from Smriti to understand exactly how a urogynecology consultation works. In the sense that let's say that someone comes in with certain symptoms. What exactly would you do, or what exactly how would the first consultation essentially go?
So, urogyne, as you can understand by the name, is a mix of gynecology part of things and the urology part of things. So, one basically assesses you. Of course, you need to come in, and there are set of questions that are asked. We may ask you to fill a questionnaire. If you have urinary symptoms, or even something like prolapse, or a pressure in the vaginal region, or sometimes pain in that area, sometimes difficulty in intercourse, so these are the women who should be seeking help. So there are a defined set of questions that are asked, then the pelvic floor is assessed, and then if it requires any kind of physiotherapy, that is offered. And if it requires any lifestyle modifications which really help in these kind of cases, so that is advised. And sometimes, as I said, medication, and very few may require surgery for their condition.
Okay. And ma'am, is there any specific age range that you usually see in your consultations? Any specific age
So
group?
traditionally, one would feel that older age women would be the ones who would be coming in for urogyne problem. But you will be surprised to know, Sakshi, so many of young girls also may have problems like frequent urination or recurrent urinary infections, or they may be contracting the wrong group of muscles. So pain, which is also called as vulvodynia, pain in the pelvic region, or sometimes the bladder gets irritated, this condition called as interstitial cystitis. So actually these conditions are spread across ages. Sometimes women may have some problem or gave birth, and after that, because of the pain that they felt in that area, they started contracting the wrong group of muscles. Sometimes there was some pelvic descent, and to stop that feeling of lack of control in that area, they started contracting the pelvic muscles in a wrong manner. So these all are and may develop pelvic floor dysfunction in those cases. So I think it's spread across the ages. It could be a young girl to a woman in old age. Yes.
All right. Okay. Thank you, ma'am. I think that was a very informative discussion. We don't have any other questions as of now, but thank you so much for joining us here and for taking us through all of these different aspects of pelvic floor dysfunction. It was a lot of useful information, and in an easy to understand manner. So I think a lot of people will find this helpful for sure. Thank you so much, ma'am. And for our viewers, we will probably see you again next week with another episode. Till then, we hope you keep safe. Thank you, ma'am.
It's a topic that's very close to my heart. So yes, I have thoroughly enjoyed talking about it and letting everyone know. We all need to be informed.
We do, that's true. Thank you. Bye.
Yeah. Bye.